And I rise today to speak on an amendment that's important to the state, my district, and to me personally. Before I do, I want to thank the people of the Plymouth and Barnstable Senate District, the residents of Plymouth, Pembroke, Plimpton, Kingston, Falmouth, Mashpee, Bourne, and Sandwich for allowing me to work on their behalf. It's an honor of a lifetime to represent my hometown district in the Senate, and my great-grandparents came to our region, our district, from the Azores and settled as humble and hardworking farmhands and local strawberry fields. And so serving as the Senate Chair of the Agricultural Committee in this district is a privilege that brings me back to my roots and the historical importance of our Plymouth and Cape community. So it's been an interesting time on the job. And in our first month after getting sworn in, I learned that the Department of Mental Health planned to close the Cape and Islands Mental Health Center in Pocasset, which is the only state inpatient mental health facility in our district. And they also were moving to close the Pappas Rehabilitation Hospital for Children right outside the district without any concrete plans to expand beds elsewhere in our region. And we have really dire need for mental health resources. The Cape and Islands has one of the highest suicide rates in the Commonwealth, 50% higher than the state average. In Plymouth County, we continue to see incidents of suicide above the state average and people struggling with substance misuse disorders. And children in our region and across the Commonwealth are reporting high levels of anxiety and depression, with families struggling to find resources, and school nurses reporting an increase in behavioral health issues. And the geographic isolation of our communities that I represent in this region have a compounding effect that can cause social isolation as well as isolation from needed health care. And when adults and children are struggling, they go see the incredible team of providers at Pappas and at Pocasset. And we heard from patients who told us that the nurses, caseworkers, and care teams in these facilities brought them out of darkness and that they saved their lives. So with the senator from Bristol and Norfolk, the senator from the Cape and Islands, we rallied the community to protect mental health in our region. Patients, workers, families, neighbors, we spoke out, we petitioned, and we were heard. We're fortunate to have a governor who listens, understands the challenges of mental health in our region, and put a pause on the closures of these facilities. But the work is not done. And this Senate is a national leader in supporting mental health. And it's through the leadership here that we're taking up my amendment, directing $4.8 million to fully fund the Cape and Islands Community Health Center in Pocasset and $31 million to the Pappas Rehabilitation Hospital for Children. Budgets represent the clearest statement of our values, and this amendment is about much more than just the numbers. It's about protecting health care access for underserved communities. It's about standing by our children with disabilities. It's about ensuring that no one is left behind because of where they live or how much they earn. The human mind is a powerful thing. It's probably the most powerful thing we have on this planet. It brought us democracy. It split the atom. It unlocks the curiosities of the universe. But its power can also be a profoundly negative force that can spiral people into destruction if they do not get the help that they need. And at some point, most of us will need that extra help. And this amendment ensures that the children and adults of southeastern Massachusetts will have the resources they need to live healthier and happier lives. So I thank you, Madam Speaker, for the opportunity to rise today, and I humbly ask my colleagues for their support, and when a vote be taken, I ask for a call of the yeas and nays.
The Senator has requested move that a vote on this matter be taken by a call of the yeas and nays. Those members joining with him in this request, please rise. A sufficient, certainly an overly sufficient number have arisen And the clerk will call the roll, but not yet, but the roll will be taken. Speech, we wish you